Carpal tunnel syndrome is typically experienced as numbness, tingling, pain, burning, or grip strength loss in the hand, specifically your first 3 digits. Carpal tunnel syndrome is caused by compression of your median nerve. The nerve starts in the neck as it comes off the spinal cord. There's 3 nerves in particular that all combine together as they go through the shoulder, and then it comes down through the center of the elbow, through the forearm, and it goes through this natural little valley that's formed between your pinky and your thumb. This area right here in the wrist is called the carpal tunnel, which is where that compression typically happens in the wrist. However, it can be contributed to by tension or compression anywhere upstream as well. But it's called carpal tunnel because in your wrist there are 8 bones. There's 4 little guys right here and another row of 4 below that. Those 8 bones all are called carpals. That's where carpal comes from. And then tunnel refers to the fact that in between all of those bones there is a tunnel that's formed, and through that tunnel goes blood vessels, tendons from the muscles of your forearm and fingers, and that median nerve. So carpal tunnel syndrome refers to compression of the nerve as it goes through that passageway. If you look at the anatomy book here, this guy right here, that shows those 8 carpal bones that I mentioned. And if we go over here, that top diagram right there, you can see just how many things pass through that wrist. So there's a lot going on right there. You can treat carpal tunnel syndrome without injections or surgery. That's the typical route that they will go, is injections to try and reduce inflammation, or surgery where they actually go in and they slice the piece of connective tissue that goes across and forms the roof of that tunnel. The problem is a lot of the times your symptoms either don't go away or they come back, and then you've already sliced that connective tissue, so your options are limited as far as what else can they do for you. But we actually treat carpal tunnel syndrome successfully all the time with adjustments to the wrist and the neck to make sure there's no nervous system tension from either of those locations. We also have you do exercise and nerve flossing, and typically we will also include decompression therapy as well. If you or someone that you know is dealing with carpal tunnel, whether that's from typing or repetitive hand motions, they can treat it successfully without having to resort to some of the more invasive treatment options.